Hello everybody, it's Dr. Catrise Austin. It is Motivation Monday. I am here with my ultimate orthodontist to the stars, Dr. Bobbi Peterson.
Hello.
And our camera woman is one of our patients in a she has been a personal friend of mine since my bad boy days, my Cancun party days. She wasn't married with kids and all that stuff. We all were skinny and sexy back then. Miss Kareen,
who does not wish to be on camera right
why? Miss Young is holding the camera, but she's going to chime in on the conversation. What made us go live today, and Kareen, this is her first time videoing us live, so sometimes people will chime in and start watching. You'll see some viewers, and they might start talking to us, so let us know if we get some people saying something, but sometimes they're shy. Mm-hmm. So Kareen came today. She's been wanting to get braces or something done with her smile for many years, and this year she has been running marathons and eating healthy, and this was the year that she said, I'm finally going to dedicate time for my smile. So she's here today, and one of the things that we wanted to talk about was what happened with her. I did a cosmetic consultation with her. Dr. Peterson did two orthodontic consultations with her, and after today's visit today, we realized that she actually needs us both.
Exactly.
So I wanted to ask you, Dr. Peterson, what was ultimately the problem that caused us to need both of us?
So initially, when I saw Kareen, she expressed to me that she just wanted her lower spaces closed. Now, in my field, we would call that a limited treatment plan, meaning I would just focus on just that issue. But having listened to her, throughout the conversation, she was basically also expressing to me the fact that her midline was off, her upper midline,
the center,
off. Right. Given that fact, that's when she went back to Dr. Austin. Dr. Austin discussed veneers with her.
Veneers are, by the way, it's what all the celebrities get when they don't want to wear braces.
Exactly.
It's an option to getting braces. They're like thin shells of porcelain. I call them the fake fingernails of the teeth, but they're not. They're really the press-on nails of the teeth. But they're custom made. They're sexy. This is what all the celebs come to me for, and they're like the thickness of a contact lens. I know that a lot of dentists out there do like the big chiclet looking veneers, but we don't do that here. So we talked about maybe doing some veneers on Kareen, but I still need the midline. I need her teeth to still be a little bit straight.
Right. The midline needs to be on in order for everything to be symmetrical. So whereas in her field she can camouflage some midlines, Miss Kareen's midline was off by too many millimeters. So what's going to have to happen is she's going to have to wear braces with me first, where I'll be able to.
For how long?
Between 6 and 9 months, where I can shift her upper midline, give her enough room to create the veneers, and also I can close the lower space a little bit.
So after 9 months or less, hopefully, I'll come in, and then it will only take me a week to do the veneers. So once she gets the teeth where I need them to be, then I will work my magic and get her teeth nice, white, straight, and everything that you had on your wish list. So tell me, as the patient, how do you feel? Because Invisalign we looked at before, that was going to be like 18 months. And after 18 months, Invisalign said that they couldn't still get you to the perfect spot, which is what made us reconsider some options. How do you feel about... And you're not going to be able to wear it. Just keep in mind, you can't do the Invisalign. It's going to have to be the good old...
Has to be traditional
brackets. How do you feel?
I'm excited for the length of time. I mean, at this point, I came this far to get this sorted out, and I feel very confident with the combinational plan, meaning I have to wear this 14-year-old bracelet
for a shorter period of time before I look like a celebrity.
So you consider it like a mild sacrifice.
Right, exactly. So I'm pretty excited, and I'm looking forward to it. So by next summer, I'll be Beachbody
next
ready.
summer.
There you go. There you go.
Ooh,
You have done your marathon already.
Yes, you're gonna be tight. Your husband better watch out. Don't let me not start no trouble. So, does she have to wear the traditional metal brackets, or are there options for her? Because are you concerned about how it's gonna look? I mean, you are in your mid-20s, mid-30s? How?
Yeah, mid something.
At a certain age.
Right. Let's just say I don't want to look 14.
Okay.
Right.
So what are the options?
I presented both options with her. One would be the traditional metal braces or metal brackets, and then I also have the ceramic or sapphire brackets.
Yeah.
And like she said, she expressed to me that she didn't want to look like a teenager, but you're going to wind up looking like a teenager anyway once you get your smile together. But
exactly.
So she's going to go with the traditional ceramics.
Ceramics.
Yes. So she'll still have wires, and she'll still have small squares bonded to her teeth, basically.
Right.
So ceramic is like is white or tooth colored. They're not as noticeable.
They're not as noticeable. The brackets that I have, the sapphire brackets, are ceramic, but they're clear.
Okay.
So
they're the most cosmetic option that you could offer to
for
someone.
her case.
Okay.
Absolutely.
Okay. Sapphire braces. Ooh, that sounds sexy. Sapphire braces. You better go ahead.
But her case is so important because initially it's like you really have to listen to your patients. If she had just come into my office and said, hey, I just want you to close up these spaces, like I said, it would have just been a limited treatment plan. But she also expressed the fact that she needed her midline moved, and she told me about a couple of other issues that she had. So I said, you know what, you need to speak to the cosmetic dentist. So it's all about really listening to what you think your patient's problems are.
Yeah.
And then you get the combination treatment, and this is what she's getting.
So tell me this, if she only wanted to move like the bottom to close the spaces, does the price differ?
Not in my office.
Okay. Because some people's like, I just got this one tooth that needs to be moved down or moved over, and they think, oh, that's going to cost $10.
No.
So general, like braces, basically braces, the cost of braces are braces?
Yes, for the most part.
Okay.
Mm-hmm.
Even if it's only 2 months of treatment? Is it
I
ever
work with, no, there should never be a case that takes 2 months.
Okay.
Braces. Ever.
So what about like the fast, like you hear other like kinds of braces, fast braces?
I've heard those
6-month smiles.
There are cases that can be completed within 6 months, but that's probably maybe 10% of overall cases. So when you hear these advertisements with, lingual braces or braces that are on the inside of your teeth that you only have to wear for 2-3 months, I don't know of any case. I've never seen any case that can be completed in 2 or 3 months with lingual braces.
Okay. Because people they ask about the braces on the backside as an option because they feel it's cosmetic and you can hide it.
They're very uncomfortable.
Oh, really?
I mean, imagine you have pieces of metal on the inside, like facing
your tongue.
Exactly.
Okay.
So they're very uncomfortable, and they take up a lot of chair time.
So you have to charge for that?
Yes.
Are those the most expensive braces?
Surgical cases are the most expensive.
Okay.
Yeah,
that's where you have to take out, or like,
the cases that require jaw surgery, where I have to work with the oral surgeons, those are the most expensive.
Okay. Yeah. Okay. So the key is to come in for a consultation, you guys, and let us see what small options we have for you. It may just be braces, it may be just cosmetic dentistry, or it may be a combination of both. So, were there any questions out there? Are they just listening to us? Nobody out there talking to us? That's all right.
That's okay.
Next time you come, you're gonna be an expert in going live,
and we will keep you posted on Miss Kareen's case.
Yep, she'll be back in July. So next month you will continue on with her case. She might just
get her hair done.
Oh,
so that's why she's not.
Well, hopefully, maybe even next time we'll go live and you'll get to see the braces being applied, and I'll definitely show you after the braces is over, a couple months down the line, what it's like to do the combination of veneers and the braces, and you'll see the final result if she lets us.
I will.
Okay. Thank you.
Bye-bye.
Bye, everybody.
Bye-bye.